Good morning everyone. Let's start with a new topic, that is kinesotaping, the theoretical aspect. We have already dealt with the practical aspect in the last video. So if you have not watched, I'll put the link in the description box below, and at the end of the video you can watch about the practical aspect of kinesotaping. These will be the contents which we will be discussing in today's lecture. So history of kinesiotape says that it was developed by Dr. Kenzo Case, who belonged to Japan in the year 1999. Basically, when kinesiotape was developed, it was used by orthopedics, chiropractors, acupuncturists, and other medical fraternity. Gradually, physiotherapists incorporated kinesiotape in their syllabus. Kinesiotape can be used for various purposes like assistive, adjunctive, in order to keep the motion intact in the pain-free range, for increasing the healing capacity, to reduce the pain, for prevention of re-injury, and etc. This treatment approach that is appropriate for any stages like acute, subacute, chronic, rehabilitative, and even in order to prevent the re-injury of an athlete. Now coming to how the tape works. Imagine this is your skin, fascia, and the inflamed tissue. As skin and fascia are present over the muscle, if the muscle is becoming inflamed, skin and fascia becomes a burden over the muscle because it is lying on the top of the muscle. Now already the muscle is becoming inflamed. So skin and fascia provides compressive effect on the muscle and its covering. So this muscle and its covering have blood vessel, lymph vessel, and the nerves. So because of the skin and fascia which is compressing the inflamed tissue, they indirectly compress the arteries and the lymph vessel, which tend to irritate the nerve endings, thus causing compression of the nerve endings as well, that is pain receptor. When applied the kinesiotape in such direction, the kinesiotape is applied on the skin. The kinesiotape thus pulls the skin and fascia towards it, as you can see in the diagram. This pull exerted by the kinesiotape indirectly decompresses the arteries and the lymph vessel, along with which irritation of the pain receptor is stopped, thus leading to dilatation of the arteries and the lymph vessel and uncompressed pain receptors. Now coming to the kinesiology tape properties. Kinesiology tape is made up of elastic strands wrapped up by 100% cotton fiber. As it is wrapped up by 100% cotton fiber, it keeps the tape dry because it has the property of evaporation. Also remember, kinesiotape is adhesive, it sticks. So basically it has glue. This glue is 100% acrylic glue, which is a hypoallergic substance. Make sure when you are applying kinesiotape on patient, do a patch test before using it as a therapeutic purpose. The patch test means you have to apply a small part or a patch of kinesiotape on the forearm of the patient. Keep it for 1 to 3 days. Check for any allergic reaction or itching reaction. If it is not itching or any allergic reaction is seen, go ahead with the therapy. Now this acrylic glue which is present in the kinesiotape makes it more adhesive as the patient wears it as the day gradually increases. This is the glue pattern on the kinesiotape is in a particular pattern, that is sinusoidal wave-like pattern. This sinusoidal wave-like pattern of acrylic not only lifts the skin but also allows for zones in which the moisture can escape, thus keeping the tape dry. Kinesiotape is designed to allow 55 to 60% of longitudinal stretch in the lasting length, not horizontal. So consider this to be your tape, it is getting stretched in longitudinal direction, not horizontally, as you can see in the video. Coming to application. Once kinesiotape is applied, it remains intact for 3 to 5 days as it is waterproof. But make sure you suggest patient not to scrub while taking bath. The combination of stretch capability, thickness, and adhesion allows the kinesiotape to approximate qualities of the skin. Coming to the general classification of types of tapes. This is not classification of kinesiotape, this is general classification of types of tape. Tape is classified into athletic, elasto-adhesive, bandage, and rigid into one corner, meconal in the center corner, kinesiology tape into the third corner. This classification is based on the stretchable capacity of the tape. Athletic, elastoadhesive bandage and rigid have 0% stretchable capacity. Thus, they are very important when you want to maintain a joint structure and its function. Myconal has only 20% of the stretchable capacity. Thus, it is very important when we are talking about strong mechanical correction. Kinesiology tape has 55 to 60% of stretch capacity. Also, it is known as dynamic tape. Thus, it is very important when you are talking about healing and muscle normalization.